Hello, my name is Bryan Peter. I'm 8 years old from Nigeria, and I came here for bone marrow transplant. I had sickle cell anemia, and my little baby brother was my donor. Thank God that it's all over now, and I'm glad to be healthy again. If not for God, I wouldn't have made it through this. Thank you.
Hello, I'm Mrs. Blessing Ezenwa from Nigeria. Bryan Peter Ezenwa is my son. He's 8 years old. We came here for bone marrow transplant. Before the transplant, he had a sickle cell anemia, which always threw us off balance due to the various crises, pains, and oftentimes, at least before the transplant, he has been transfused for, I can't remember the number of blood transfusions we've done. And thank God that it was not easy. And how I met Dr. Gaurav, it was God sent. God connected me to him, and I'm glad. And indeed, I've come to realize there are doctors and there are doctors. There are doctors beyond borders. And I will say, with my experience with Dr. Gaurav, he is one among the doctors beyond borders, because there are people that have hand of healing, that God is actually with them. And I thank God we came during the period of this, before the BMT. I've learned a lot. Now, the transplant was successful. Today we are 100 and we are above 100 post-transplant.
Namaste. I'm Dr. Gaurav Kharya. I'm working as a clinical lead Center for Bone Marrow Transplant and Cellular Therapy at Indraprastha Apollo Hospital, New Delhi. You just met a young chap, I would say, by the name Bryan Peter. Bryan is a case of sickle cell disease. He was diagnosed with sickle cell disease at very early in life, so maybe when he was 6 months, 7 months of age. And the common presentation was he started having pains and aches and swelling of small joints, along with low hemoglobin and fever. And when he was evaluated, he was diagnosed to have sickle cell disease. Sickle cell disease, as we all know, is a disease where the red cells are affected. They become sickle shaped. And because of this, the kids or the patients have significant problems. The commonest problems are swelling or painful joints. But because these sickle cells circulate everywhere in the body, they have this capacity to damage each and every organ of the body, starting from brain, where it can manifest as stroke, or eyes, where it can manifest as retinopathy or retinal detachment, or lungs, heart, kidneys. So every organ of the body can be affected because of sickle cell disease. Bryan had multiple problems because of this, and he was receiving regular treatment by colleagues back in Nigeria. But when it was realized that his problems are persisting despite being on optimal supportive treatment, then they were counseled about a possible curative option, which is bone marrow transplant. Bryan underwent a transplant initially, which was a haploidentical transplant at some other place, but unfortunately, because of some or other complication, because of viral reactivation or something, it did not work. Then they came to us and we evaluated and we counseled them that it does happen that transplant doesn't work for the first time, but that does not mean that it will not work for the second time also. So after a detailed discussion, we took him up for a transplant the second time, and his younger brother, who's around 1.5 to 2 years of age, was a donor. and by God's grace everything went off well. He tolerated the transplant procedure very well, and he's around 4.5 months, 5 months post bone marrow transplant, doing very well. You have already seen him. He's growing weight, his appetite has gone up, his hemoglobin levels have gone up. So his hemoglobin prior to transplant, we were hardly beyond 8 grams per deciliter, but now his hemoglobin is around 13 or 14, and he does not have any problems related to sickle cell disease.